Hi everyone, how are you? Welcome to another question and answer session. This is the physiology portion of MRCS. A 73 years old lady is admitted for a laparoscopic cholecystectomy. During her pre-operative assessment, it is noted that she is receiving furosemide for the treatment of hypertension. Where is the site of action of this diuretics? So it is one of the direct question that the at which site of the kidney the diuretics occur. Actually it is the furosemide. So we have to find out at the area where the furosemide acts. Here the options are proximal convoluted tubule, descending limb of Henle, ascending limb of loop of Henle, distal convoluted tubule, and collecting duct. So we have to find out one of the site in which the furosemide, which is a diuretics, it works. Actually there are different drug acting on different part of the nephron, and this reduces blood pressure. So here we can see this is a nephron, as the nephron showing the different part. Here this is the glomerulus, then this is the proximal convoluted tubule, loop of Henle, distal convoluted tubule, and collecting ducts. So it is in short about the nephron. So now first of all here we can see this is the proximal convoluted tubule, and in proximal convoluted tubule the diuretic works, which is the carbonic anhydrase inhibitor. So the carbonic anhydrase inhibitor, it works in this area, which is the proximal convoluted tubule. Then here you can see loop of Henle. Actually loop of Henle there is no important diuretics. Then actually some parts, ascending part of loop of Henle, their uh, diuretics works, which here we can see this area. So loop diuretics is worked in the ascending limb of loop of Henle. Then here in the third part, here we can see this is the distal convoluted tubule, and distal convoluted tubule the thiazide diuretics works. And finally the collecting tubule or collecting ducts, here the potassium sparing diuretics works. So it is in short about diuretics working in different part of the nephron. So first of all, proximal convoluted tubule, carbonic anhydrase inhibitor. Loop diuretics here in the thick ascending limb of loop of Henle. And then here we can see in the distal convoluted tubule thiazide diuretics occur, and collecting tubule and collecting duct, their potassium sparing diuretic works. And we know that the loop diuretics, they are furosemide or semide, they are the loop diuretics. So here we can see the action of furosemide, it is ascending the limb of loop of Henle. That means in the loop of Henle there works furosemide. And then furosemide and bumetanide are loop diuretics, acts by inhibiting sodium potassium chloride co-transport in the thick ascending limb of loop of Henle, and it blocks the sodium potassium and chloride absorption. So sodium potassium and chloride, they are excreted into urine by taking water, and then reducing the absorption of sodium chloride in this area. So finally here we can see our answer is now ready. It is, as it is the direct question, that the ascending limb of loop of Henle, here loop diuretic works, and the loop diuretic mainly furosemide. So furosemide works in the ascending limb of loop of Henle. Other areas such as here we can see the proximal convoluted tubule, here the carbonic anhydrase inhibitor works, descending limb of loop of Henle. Actually there is no important drug. Distal convoluted tube, here the thiazide diuretics are collecting duct, here the potassium is sparing diuretic works. But in case of ascending limb of loop of Henle, here the loop diuretics, which is the furosemide. Thank you all.